Hi, we will be seeing the first theory formulated in nursing, that is the environmental adaptation theory by Florence Nightingale. Let's see regarding the theorist. She was born in May 12, 1820 in Florence, Italy. She can never be called a theorist. She was a healthcare reformer. She is known as Lady with the Lamp. Crimean War made her closer to those people suffering injustice. If we can see her history, we can see travel has played a big part in Nightingale's life. Starting from Keshavarth, where she received her first training in hospital, later in many hospitals of Ireland, Paris and London. Mortality rates reduced in Barak Hospital with her improvements in sanitary conditions. In her book Notes on Nursing, she wrote what to and what not to do during sickness. And she died on August 13, 1910. The typology of this theory is a philosophy. Assumptions of Nightingale's model. The first assumption is nursing and medicine are separate. The point which we nurses are forgetting nowadays. Care and cure are two different aspects. Nurses are there to cure the patient through caring. Second, training must be provided for nurses in caring patients, and this training must be organized and a formal way. She emphasized on collegiate education. Knowledge and skill both are important in nursing. Environment plays a vital role in the health of the patient. To her, disease process is not a big matter of concern in nursing. Nurse must modify the environment to help the patient heal. Research must be used in nursing, and it must be through observations and statistics. So from the first nurse theorist itself, we are emphasizing on research. There is always an interaction between the patient and environment. Environment is what the nurse manipulates, which includes physical elements external to the patient. 6 elements of environment are essential for an individual's health. They are clean air, pure water, efficient drainage, cleanliness, good food and light. Nightingale's environmental model. Hygiene is the most important aspect in life according to Nightingale. To her, person will achieve maximum health when environment is modified. When nurse is caring, manipulation of external environment should happen. Patient is the center of her model. There should be a positive balance between the patient and the environment when the person is healthy. And when the person becomes sick, there is a disharmony between the person and the environment. And the person has to put extra energy to counter the problem, and healing will be delayed. So we can see the different aspects which are included in the Nightingale's model one by one. First, health of houses. Badly constructed houses or hospitals is not good for a person's health. The air may be stagnant in the house and sickness will be following. Next, chattering hopes. The sick person should hear good news and good advices. It would help the person to become healthier. Cleanliness. The surrounding, the patient and the surroundings should be clean. The personal cleanliness is given much importance. Keeping the patient clean, and also the nurse must perform hand hygiene more frequently. Ventilation. Air must be pure without any chills. and the windows should be kept open for fresh air to come inside. Noise. Noise should be kept to minimum when a sick patient is there. Conversation and whispering, it should be away from the patient because it will irritate the patient. Air. The air must be pure that the person breathes, and it should not be too cold. Nutrition. The patient should be getting nutritious food, and also the serving should be small and frequent. The nutrition should also include good water. Light. Direct sunlight is what patient wants according to Nightingale. Bedding. To her, bed should be placed in a place from where the patient can see outside from the window. Caregiver should not be sitting or shaking or leaning against the patient's bed. The bed should be wrinkle free. Variety. The need of color and changes was emphasized by Florence Nightingale. Boredom should be relieved with some or the other activities. So these are the different concepts which are included in Nightingale's environmental model. Florence Nightingale's main concept consists of 6 Ds, we can tell. First, dirt and dust. Personal hygiene as well as sanitation of houses are included in this. Drinking water must be pure. Dietary habits must be healthy, fresh and balanced diet. Regarding damping, everything should be dried out and little warm environment should be there. Chillness should be avoided. Droughts, the air quality should be pure, there should be good ventilation. The drainage system, there should be a good drainage system and sewer system in the houses and in the community. Nightingale's theory and meta paradigms. Environment. The physical environment is given importance. The community aspect is given preference. The social and psychological environment is not included in her model. Second, person. Human being is not defined directly in her model. A dynamic and complex being who is having a disharmony with environment due to which he or she is receiving care. That might be a person according to her. Health. Health is also not well defined by her in her model. She explained health in a way that a person must be able to use well every power he has. At that state, he or she is healthy. When the person is able to utilize the entire energy to balance with the environment, that time the person is said to be healthy. Nursing. Nightingale believed nursing is God's calling. Nurses have to assist patients during illness in such a way that nature will act and provide healing. Nursing is defined by her as the act of utilizing the environment of the patient to assist him in his recovery. Nightingale's philosophy and nursing process. Nightingale's philosophy fits well with the use of nursing process. This model can be well incorporated with the nursing care of patient. This picture you might have seen in the introduction of the theory. The first picture you can see the environment is not clean. The second one, environmental modifications has created and the patient is healthy and happy. When the nurse meets the patient, assess the patient's environment also. It is not checking the vital signs or any other thing. We have to see for the patient's environment also. When planning care and implementing it, frequent re-evaluation of the situation should happen for better patient care. The documentation of care is also important as the next caregiver can follow the care plan. The steps to be carried out by a nurse when applying Nightingale's model in patient care. There are a number of steps which you can follow. First, Assess the client's body temperature, room temperature, and room for fresh air or adequate ventilation and foul odors. Develop a plan to keep the room airy and free of odor while maintaining the client's body temperature. So ventilation is given importance and temperature is given importance. Then assess the room for adequate light. Sunlight works best. Develop and implement adequate light in the client's room without placing the client in direct light. Third, assess the room for dampness, darkness, and dust or mildew. Keep the room free from dust, dirt, mildew, and dampness. Assess the surrounding environment for pure air, pure water, drainage, cleanliness, and light. Examples include removing garbage or garments from the area, removing any standing water, or ensuring that the water drains away from the area, and ensuring that air and water are clean and free from odor, and that there is plenty of light. Assess the noise level in the client's room and surrounding area. Attempt to keep noise level to a minimum and refrain from whispering outside the door. Then the bedding and bed should be seen for dampness, wrinkles and soiling, and check the bed for height. Keep the bed dry, wrinkle free and at the lowest height. Attempt to keep the client dry and clean at all times. Assessment of the client's skin is needed to maintain adequate skin moisture. Attempt to stimulate variety in the room and with the client with cards, flowers, pictures, books or puzzles. Encourage friends and relatives to engage the client in stimulating conversation. Avoid talking without reason or giving advice that is without any fact. Avoid personal talks and negative talks. Assess the diet of the client. Take note of the amount of food and drink ingested by the client at every meal or snack. Intake output should be maintained. In the assessment of the diet, include the type of food and drink the client likes or dislikes. Ensure continuity of care. Documentation of the plan of care and all evaluation will ensure others giving the same care to the client in your absence. So document everything. Observe everything about your client. Record all observations. Observations should be factual and not merely your opinions. Continue to observe the client's surrounding environment and make alterations in the plan of care when needed. You can think about this scenario. When you are going to enter the patient's unit as a nurse, you must look into the surroundings of the patient, how the bed sheet is, does it have wrinkles, is the food kept open, is there fresh water available in the jug, whether patient's unit is soiled with urine or stool, is there provision of fresh air, is the unit clean and tidy, lighting, is it adequate or not. Nightingale's model and characteristics of a theory. You know that 7 characteristics are there for the theory. So if that 7 characteristics are fulfilled, then we can call this thing a theory. The first one, interrelate concept. You know that from that picture itself, all the concepts, air, water, ventilation, everything is connected to the patient. So there is an interrelation. It's logical in nature. We are able to understand the meaning and the sense. It is relatively simple and it can be generalizable. Certain quantitative and qualitative hypotheses can be tested with this. Though Nightingale rejected the germ theory of illness, that part cannot be tested. Otherwise, quantitative and qualitative hypotheses can be made and we can test this theory. Contribute to and assist in increasing the general body of knowledge whenever we are using this theory. Can be used by practitioners to guide and improve their practice. It is consistent with other validated theories, laws, and principles. So, her work can be considered a theory, though Nightingale formulated it as a philosophy. That is why, in the typology of the theory, I told this as a philosophy, but it can be considered also as a grand theory. There are some strength and weakness for this theory. It can be applied in any setting, in the hospital or in the community. It enhances critical thinking among nurses. So we will be going and seeing the patient side and we will be assessing all these things, and critical thinking all automatically happens in nurses' mind. It can be used with any group of patients from children to adults. Weakness. The psychological and social aspects were not given any importance in the theory, only the external environment was given importance. It can't be used in autoimmune and genetic conditions, so that is a weakness. So even if we manipulate the environment, no changes will happen in these type of diseases. So, in the current nursing practice, Florence Nightingale's model is the life and essence of nursing. It even highlights the fact that even bed making, a basic procedure in nursing, can have a positive impact on patients' health. Nightingale's model is applicable both in hospitals and community. Please do subscribe to this channel. Thank you.